Hi, I'm Ogbemudai Eddy and I'm a Nigerian medical student and I'll be talking about emergency medical services in Nigeria. There's developing countries, with the exception of South Africa and Ghana, really do not in Africa really do not understand what we call emergency medical services. Well, for this country, and the worst hit is Nigeria, as a country with a population of over 170 million persons, do not have an emergency medical services to take care of these persons in times of medical emergencies. Habits, someone might faint in a market square in Nigeria. It's interesting to know that the persons on scene, they really do not know what to do. They have to, all they know is the fact that they have to look for a vehicle to transport the person to the hospital. What happens when such person dies on the way to the hospital? And even those that are involved in road traffic accidents, they are left at their mercy. With this, you agree with me that Nigerians are living at their mercy, on the streets. Okay, first of all, what's an emergency medical service? It's an intercalated system of healthcare where a person receives pre-hospital care, where a person receives medical treatment before arrival at the hospital. Emergency medical services has three components. One of such is pre-hospital component, the in-hospital and the in-hospital component. The pre-hospital component is being handled by emergency workers such as paramedics, and the in-hospital component is being handled by trauma surgeons who are specialist medical doctors. You see, when a person faints, there is the need for us to know basic medical skills to administer to such persons. Because of the fact that we really do not have an emergency medical service in Nigeria, this has led to a fall in our life expectancy rate, because persons die of such seemingly avoidable deaths. A death such as stroking could kill someone in a country like Nigeria. And in curbing this, there's the need for the government to massively invest in our healthcare system. The government must massively invest. There's also the need for our ministries, for the Ministry of Education, to also incorporate an emergency medical service curriculum in our scheme of study. With such, every Nigerian will be well equipped with basic first aid skills to administer whenever an emergency medical condition occurs. There's also the need for us for training and retraining of manpowers in the health sector. Trauma surgeons, emergency room nurses, paramedics, and every other health workers need to be trained and retrained on how to administer basic first aid skills. Aside that, there's also the need for individuals, for public spirited individuals, rich individuals, business moguls must understand the fact that the government alone cannot take care of our emergency medical services. And as such, there's a need for government, for public individuals to invest massively in it. With this, I believe we'll be able to reduce the effects of persons dying during conditions of emergency medical service. Thank you.